Hey everyone, I hope this podcast and my blog and books have been helpful resources for you and will continue to be. But if you've been struggling with a chronic health problem and are feeling stuck, consider coming to work with my team and me at the California Center for Functional Medicine. We work with patients all over the US and have experience treating a wide range of conditions, including GI problems, autoimmunity, hypothyroidism, cognitive mood and behavioral issues, weight gain and metabolic dysfunction, and more. Our unique model teams clinicians with nurse practitioners and health coaches, all of whom are trained in my ADAPT framework approach to provide a high level of care to our patients. This means more support between appointments, personalized guidance on diet, lifestyle, and behavior change, a cutting-edge patient portal with 24/7 access to your labs and records, handouts and resources to guide your protocols, and a team of practitioners working together on your case. We're currently accepting new patients, so if you'd like to learn more, visit chriskresser.com/becomeapatient. Hey everyone, Chris Kresser here with a brief message before we begin the podcast. Imagine a career that draws on your passion for wellness and disease prevention, that harnesses your ability to support and connect with others, that helps you to develop as a person while you help others to do the same. What if you could earn a living while making an impact on thousands of people's lives and even on the future of healthcare? That'd be pretty great, right? Well, that job does exist. It's the job of a health coach, and I believe that health coaches will play a crucial role in the future of medicine, not only in the US, but around the world. 1 in 2 Americans now has a chronic disease, and 1 in 4 have multiple chronic diseases. Chronic disease is destroying our quality of life, shortening our lifespan, bankrupting governments, and threatening the health of future generations. And our medical model is not prepared to address it. Why? Because the only way to prevent or reverse chronic disease is by changing our diet, lifestyle, and behavior. And conventional medicine is simply not set up to do this. Bottom line, we need people who can provide this support to help people make the changes they need to make to save their lives. We need empathetic and compassionate people with a skill for connecting and a passion for change. And my job is to make sure they have all the training they need to do their job so well they will change the future of healthcare. A career as a health coach can be incredibly fulfilling both professionally and personally. It really could change your life, and it can also change the world. That's why I'm excited to announce that we're launching the ADAPT Health Coach Training Program. It's a 12-month, 100% online certification that will prepare you for a successful career as a health coach. It includes training in core coaching skills, functional health, ancestral diet and lifestyle, and professional development. And it's unlike any other health coach training program currently available. To be notified when enrollment opens and to learn more about the program, visit kresser.co/success. That's KRESSER.co/success. Now on to the show. Hey everybody, this is Chris Kresser. Welcome to another episode of Revolution Health Radio. This week I'm excited to welcome back Dr. Ramzi Asfour as my guest. You may recall that I did a podcast with Ramzi a little while ago on the connection between Lyme disease and gluten intolerance and celiac, which was really fascinating. We had originally planned to do part 2 of that podcast because there was a lot of material that we hadn't covered today. But given the coronavirus outbreak and given Ramzi's background as an infectious disease specialist who has a lot of experience with viral illness, we thought it would be better to do a show on coronavirus, what it is, how to protect yourself, and how to treat it if you get infected. So that's what we're going to talk about today. Ramzi Asfour is a board-certified infectious disease and internal medicine doctor. He graduated from New York Medical College, then completed an internal medicine residency program at California Pacific Medical Center, followed by a fellowship in infectious diseases at UCSD. He's worked for the World Health Organization, Columbia University in South Africa, and the University of California, San Diego. Prior to attending medical school, Ramzi majored in genetics at UC Davis, and he's currently assistant clinical professor of medicine at UCSF. and he is a staff physician at California Center for Functional Medicine. So I hope you get a lot out of this podcast. This is obviously a topic that's on all of our minds, and there's a lot of good information out there. There's some not so good information out there. So I wanted to have this podcast with Ramzi so we could just give you the evidence-based information that you can use to protect yourself and your family. So let's dive in. Ramzi, it's such a pleasure to have you back on the show, although I wish the circumstances were a little bit more positive.
I agree. Thank you, Chris. Yes, it's always a pleasure to be on your show, and it is quite an interesting time.
So originally, we were going to do part 2 of the excellent series you started on looking at the connection between Lyme disease and gluten intolerance and celiac. But given the current coronavirus outbreak, we decided that, especially given your background as an infectious disease doctor, this time would be better spent talking about the coronavirus and the current status of the outbreak as of Tuesday, March 3rd, when we're recording this. And of course, share some tips for what people can do to protect themselves and what they can do if they do become infected or develop a cold or a flu, which I think part of the issue here, which I'm sure we'll cover, is how do you even know if you have it? But let's spend the first part of the time talking about coronavirus in general, explaining what it is, covering the epidemiology, current status, what's happening globally right now, and then some protective measures that people can take. And then I will spend some time talking about further preventative methods and also treatment from my perspective as an herbalist.
Sounds great, Chris. First of all, it's a coronavirus. Everybody knows that the name is now called COVID-19, and some people are also referring to it as SARS-CoV-2. And it's and just some background. Its genetic material is called RNA. It's similar to some other coronaviruses that are present in bats. And with SARS, you might remember it was thought to be a bat origin, but then it transmitted to humans through these creatures called civet cats, and which are apparently a delicacy in some parts of the world. And MERS, which is also a coronavirus, was through the single hump camels, or the dromedary camels that were an intermediate host. In the epidemiology, it appears that in China, the spread is starting to slow down. There are draconian restrictions in places we know, which is not going to happen in Europe or United States for sure. So but that's a good sign that the epidemic seems to be slowing down. The number of new cases being reported and number of deaths seems to be decreasing. That is not the case in Europe. Obviously, people have heard about Italy in the media. I just read that museums in Milan are opening again, but people are being advised to maintain 3 feet of distance apart. That is probably reasonable, but there is significant activity in northern Italy, especially. And in France, you might have heard they closed the Louvre Museum. And I was just reading the news in French. They're talking about canceling all big sporting events, concerts, everything throughout the country. They haven't made a decision yet, but that is something that could certainly happen, and that's what happened in China. Many schools in the south of France, in Nice, that are close to the Italian border, have already been closed since last week. So also large gatherings have been banned in those areas. So that is a little bit of what we might be looking forward to, unfortunately, in our country, and especially on the West Coast. The spread, most concerningly, is that there are new infections popping up. There were 3 probable new cases yesterday in Santa Clara County, so that's Silicon Valley. We already knew of 2 confirmed cases there without spread or without contact with travelers or without a travel history to one of the now 5 countries that are high risk. That's South Korea, Italy, Iran, Japan, and of course China, including Macau and Hong Kong. So We also know that there's still some flights. For example, I actually saw a patient yesterday who just arrived from the Seychelles on vacation. I asked her, what was it like in Heathrow Airport on her transfer over? She said, well, quite a few people were wearing masks, and including customs officials and airport staff, security personnel, and passengers. But when she landed in San Francisco, there was a flight from Hong Kong that just got in, and about 80% of those people were wearing simple face masks, at least. We'll talk about that and the level of protection you might get from that later. So that the spread is probably increasing. We're still having a lot of international travel. There's a few cases in New York. There were some travelers from Milan that just landed in New York a couple of days ago, and they're reporting symptoms, but they can't get a test done. So and that's a problem, not being able to get a test done. So the nursing home outbreak in King County near Seattle is also very concerning, especially because that population is older and seems to be much more at risk from this virus. So we have a major confluence of factors here. We've got some cases popping up in the West Coast especially, but some signs that even on the East Coast, and including Florida, there are some cases without a travel history that are popping up. So I suspect we are going to see widespread activity of this virus in lots of parts of this country, especially on the West Coast, in the Bay Area, in the Seattle area, and probably in Portland too. Seems to be more so than Southern California, at least at this point.
Is there any reason for that?
Probably I'm not so sure why the Seattle area has been more affected, but certainly there are lots of travelers from affected areas, especially from China, that commute back and forth to the West Coast. And I don't know what the situation is in Vancouver, British Columbia, where there's obviously also a very large Chinese community. That would be interesting to look at, but definitely in Seattle, San Francisco Bay Area, there's a lot of travel to and from China. Silicon Valley's here.
Right. I mean, the West Coast makes sense for that perspective, but it's unclear to me why LA wouldn't be included, just given that it's just so huge and there's a lot of travel to and from everywhere in LA, including Asia.
Absolutely. I mean, it's a bigger metropolitan area than the Bay Area, so
yeah.
I'm not sure why that's the case. One can speculate a lot of things. We really don't know enough about the virus yet, so take what I'm saying with that in mind, that we don't have full knowledge. Some people are postulating that warmer weather is a detriment to the spread of the virus, as it is for influenza, because droplets are one-way respiratory droplets. So when you're speaking, for example, especially though when you're coughing or sneezing, there's lots of fluid droplets that you release into the air. And depending on who you talk to, those can spread between 3 and 6 feet. So some people say stay 3 feet away. Some people say stay 6 feet away. But those droplets in warmer weather they evaporate more quickly. The spread is probably less. That's one of the reasons that we think that seasonal influenza, for example, is not as prominent in the summer as it is during winter and fall, for example.
So I know we've talked about this a little bit offline, and you suspect that the incidence of coronavirus infection is already significantly higher than we know about, simply because the testing is not widely available. So, people who are around us who are coughing and maybe have signs of the flu, especially adults who are not necessarily particularly sick, may already be infected, but we have no way of knowing that.
Absolutely. I think that's one of the biggest concerns. So to address that, let's talk about testing a little bit. And so unfortunately, I have a lot of faith in our CDC, and I used to work at World Health Organization. I'm a big proponent of strong public health infrastructure. I think that's very, very important. overall. And unfortunately, our investment in public health infrastructure at the county level, in the United States, it's really at the county level where the on-the-ground people are, but also at the state and national level has been decreasing. And budget cuts, we haven't been funding public health infrastructure as we should, as much as I think we should be. And that's evident in the CDC's response to testing. So for example, for SARS or especially Ebola, the CDC wanted to run all of the tests, and I think that's fantastic. I think that's the right thing to do. But we did know about the huge number and burden of tests in China, and most people, we should always plan for what's a reasonable worst case scenario. That, in my opinion, in these kinds of infections, I like to use the term reasonable worst case scenario. So not, an end of the world scenario, but what's a reasonable worst case scenario? And that is that we have high levels of activity of this virus throughout the country or throughout much of the country, with a prevalence eventually, we could see as many as several percent of our population being infected, perhaps more, perhaps less, but that would be a reasonable worst case scenario. So that means that we should have been implementing and ramping up testing capacity earlier on than we were. I don't know the details of the fine people that work at the CDC. I have a lot of respect and I have a lot of friends that work at the CDC. So I don't know what the details are behind the testing, but the good news is that the FDA cleared the way to let people use what we generally call in-house testing kits. So those can be private laboratories and university laboratories that are able to develop their own kits, test them, and then just release them with a communication with the FDA without full formal FDA review, which can take years. So also the Germans developed a kit that was adopted by the WHO, and it's unclear why the CDC didn't just say, well, let's just use that kit. They were able to ramp up production. But regardless, the testing issue is now being resolved. By the end of this week, we should be able to test maybe even 1 million people in this country. That would be fantastic. That will give us a sense of how many people have been infected already and what we need to do, how we need to cohort. Cohorting means grouping people according to infection status. So if there's a whole family that's been infected, do we send them, if there's for example, at a school, what do? Do you, maybe there's 5 kids that are infected. Do you quarantine their whole families? How do you handle all of that situation? I advise, in one of my roles, I advise nursing homes and hospitals on how to manage this type of situation, infection. We call this infection control and infection prevention. And nursing homes, as we saw with the nursing home near Seattle, that's an elderly population. They're at very high risk. We are already advocating limiting visitation, possibly, and limiting group activities within the nursing home. The risk to the nursing homes is probably from visitors or staff that have traveled or gotten sick in the community. Right now, the CDC is they were initially requiring you to have traveled to China and be sick in an ICU to be tested. They've reduced that criteria. Now you can travel to one of those 5 countries that I mentioned earlier, or be critically ill in an ICU. We still today don't have enough testing kits to test many more people, but we will hopefully at the end of the week and by next week be able to test quite a few people more and get a better sense of what's going on. But I'm advising my, even friends and family, I would not travel unnecessarily. If you have an important meeting to go to, especially if it's in a smaller group setting, that's reasonable. But, travel does have some risk. The risk is probably going to get higher for the next few weeks at least. And at that point, we'll know a lot more. But, we're not advising completely eliminating airplane travel. We're not advising completely eliminating social activities. but we need to be thinking about it, planning for school closures, planning for cancellation of sporting events, for example. I'm not a huge sport fan, but if somebody offered me tickets to go see the Warriors, I might say
pass on
no.
that this time. Yeah.
I'll pass this time.
Yeah. So let's come back to that, because I want to talk and help our listeners think through some of these questions about prevention and how concerned do they need to be. And I think the answer to that also varies depending on how their age and their health status and where they live and some other factors. So I want to dive into that a little more deeply. But before we do that, I think it would be helpful to compare what we know currently about coronavirus in terms of its RO value, how infectious it is, compared to something like seasonal influenza, which people are more familiar with and can use as kind of a benchmark. And then what the risks are relative to something like seasonal flu with coronavirus for different populations. Because I think part of the panic is coming from, at least with some people I talk to, not really understanding the risk of what it means to get infected with coronavirus.
Right. Thanks. That's a great point. So the risk of infectiousness is probably about as bad as a bad flu, perhaps a little bit more. We don't really know. Epidemiologists call that the R naught value or R0. And that means how many people are likely to be infected from one person who's carrying the virus or who is infected. And for seasonal influenza, it's about 1.3 people are infected for every person that has the flu. And initially, we thought the RO for coronavirus was higher. It appears to be about 2.2 right now, but it might actually be lower. It's difficult to say because of initially the reporting from China was spotty, and there was concern with testing capacity, some of the issues we've already discussed. And then the second biggest outbreak was on the Diamond Princess, the cruise ship, and that was not a very well managed situation in terms of spreading infection there. So it seemed more infectious perhaps than it would be in the community. So for example, this is a very bad flu season. On top of having coronavirus, this season is a bad flu season. And I've been reinforcing recommendations to get vaccinated for flu for several reasons. Think about the statistics. There are so far this flu season, 310,000 hospitalizations for influenza and 18,000 deaths. So let's just think about how many ventilators those people who have flu that could potentially be preventable and is treatable. We have drugs for flu. If the flu vaccine is only 50% effective, and this year we think the vaccine might be 50% effective, somewhere in that ballpark, then you could cut down those hospitalizations or deaths in half, at least of the patients who have not been vaccinated. And I don't have those statistics broken down, who's been vaccinated and who's not. But we also know that people who are vaccinated tend to have less severe illness. So especially in a bad flu season, but also in a season where we need to protect our precious hospital resources. And so this is a public health issue. Your listeners might not know, but hospitals have been downsizing for a couple of decades now. Every time they build a new hospital, like in San Francisco, California Pacific Medical Center, they built a very nice new hospital, but there's fewer beds. And the same is happening all over the country. Newer hospitals tend to have fewer beds than their older counterparts that they're built to replace. That's for complicated reasons, but we don't have the capacity to hospitalize lots of patients in intensive care units who might become sick with the flu. With the coronavirus, and even in the bad flu season, our capacity is overwhelmed in some regions. So flu is very bad, dangerous. Don't forget that. It's still in this country right now the more common cause to have a cough, fever, body aches. That's probably going to be flu rather than coronavirus even today.
Mm-hmm. So just did some quick math while you were talking there. 32 million flu cases, 18,000 deaths. That's about a 0.56% mortality ratio.
Yes.
I know this is a moving target, and initial estimates were as high as 2% for coronavirus, but have since been revised down to maybe 1.4%. And you have told me you suspect it may be lower because if we don't know what the denominator is, we don't know how many people are actually infected. We can't really come up with good data about that. But what's the best guess right now in terms of mortality ratio?
It's uh, it's difficult to say, but my suspicion is it's probably no. It'll probably settle around 1% or maybe even a little bit less. We really need to know what the denominator is, and we need to know how many younger people who tend to have milder illness or even no symptoms. We need to know how many of them have been infected, and we might not learn that for several months. One of the ways to learn that would be to just do antibody tests on people's blood to see. You can do an antibody test, for example, to see if you've ever had mono. So we can do an antibody test to see if you've ever had COVID-19. We can't do that today, but we will be able to do that test soon. And so that will give us the denominator that we'll need to really answer that question. But the illness seems to be very mild, or in children, younger people, young adults. I'm definitely concerned that I believe Dr. Lai, the 34-year-old Chinese physician, died of the virus in Wuhan. So that's concerning. But we don't know what if he had any underlying medical issues.
Mm-hmm.
There are the mortality seems to be quite high in elderly people, however. And so what you have to think about is not only will you infect, like if your family, if you have a young family, if they get infected, probably not a big deal. It's going to be like a bad cold or a mild flu. But if you have grandparents that you're in contact with, and especially if they have emphysema or some other underlying lung or cardiac condition, they're probably at higher risk. And that risk probably goes up quite a bit. So we've had 4 deaths of people in the nursing home and several more in the intensive care unit from that one nursing home. And I don't know how many of those patients have been infected in the nursing home overall, but it sounds like it's much more serious in the elderly. So we have to think about that. So you might be, if you're living, for example, with with an elderly person who has some lung issues, then you might take more precautions and you might say, well, I am not going to do that traveling because I'm going to be with grandpa, and if grandpa gets infected, it could be super serious.
Right.
That's a consideration to take in mind.
So what are you, couple follow-up questions on that. When you say elderly, are we using over 65 as the cutoff, or what's the age cutoff that in the research where you see the mortality ratio start to increase significantly?
I don't have a firm handle on that, but it seems to be, it's probably closer to 70 or 75 even.
Mm-hmm. Yeah, these days, 65 people would take offense if they're 65 and you classify them as elderly these days.
Exactly. No, 65 is the new 50.
Yeah. So in the 70s, and of course, there's individual variation there, because if someone has taken really good care of themselves and they're, in excellent health at 70, then we could probably assume that their immune system is functioning better than someone who's in very poor health at 70 years old.
Absolutely.
Yeah. So this is also different than the flu and with influenza, you elderly are at greater risk as they are with coronavirus, but it seems there's a distinction here with children, whereas children are often at higher risk for for influenza, but it doesn't seem that that's the case with coronavirus. Is that right?
That's correct. It does seem to be the case that children children and the elderly and pregnant women tend to be affected by influenza to a higher degree. If you guys remember, if your listeners remember the swine flu epidemic, about 10 years ago now, that also affected overweight people disproportionately with that particular flu, as well as pregnant women and children. But we're seeing a skew here. It's not clear if pregnant women are at higher risk. We don't think so yet, which is great. But it's definitely a one-sided skew towards the elderly being more severely affected.
Let's see if there's anything else we want to cover on, epidemiology and risk. Looks like I think we've touched on most of that. Let's move on to talk a little bit about protection. What are the things that will make the biggest difference? You already touched on some of them in terms of avoiding unnecessary travel and staying away from larger groups. I have a few follow-up questions about that, and then we can talk about things like hand washing and hand sanitizer and maybe not shaking hands, things like that. And then I'll go into some of the botanical and nutrient-based protection and treatment stuff after
Fantastic. So a lot of people are asking, should I wear a mask? And my answer is, please, if you're sick and coughing and you have to be out, for example, going to a doctor's office, that's when you should wear a mask. But if you're just walking in the community, don't wear a mask. Save that. We call those masks and gowns and other devices, we call that personal protective equipment. We need to save the personal protective equipment for those who really need it and would really benefit from it. Most people don't know how to wear masks appropriately. A simple surgical mask that you might buy at a drugstore is not that protective. If you have facial hair, it's even less protective. And N95 masks people might have heard of, or even N99, but we in healthcare generally think that N95 masks are sufficient. Those need to be fitted, and you have to be fit tested. There's certain ways to wear them to offer full protection. And I'm not recommending that people wear masks. I have a flight booked to L.A. Later in the month. I'm not planning on wearing a mask. I'm planning on flying. But I mean, it's hand washing. It's frequent hand washing, 20 seconds minimum when you wash your hands, and not touching your face. So humans touch their faces way too often.
20 times an hour from what I've seen,
right.
At least on average.
Yeah. I catch myself doing it.
I do too. And so that leads to a follow-up question about the mask. I've seen some recommendations that a mask might be helpful only insofar as it would limit contact between our fingers and our mouth and our nose. What do you think about that idea?
That's true, but I'm not sure of the science behind that, because the mask irritates the face, right? You're going to need to reposition it often, so you're going to be touching the mask quite often, and then
if your fingers are touch coronavirus, the coronavirus can survive on the surface of the mask, right? If you touch
and then
the mask.
Exactly, and then it's gonna irritate your skin. You're gonna massage the skin that it irritated. It's not going to help that much. It's certainly not going to help at home. The cases where a mask at home would be recommended are when when you're being quarantined, basically. And then if you have to step out from let's say you're quarantined in your bedroom and there's other people in the household who are not sick, then you might wear a mask when you're going to the kitchen to prepare your meal, but you'll eat your meal maybe in your room. I mean, this is a whole can of worms that we haven't even figured out how to deal with to handle isolation at home in these cases. There are some protocols and procedures, and a lot of people working on that. And we've done it for cases of tuberculosis before, so we do have some experience, but it is, it's concerning, and that might be an area to wear a mask. But
well, here's another question along the same lines. What about latex or nitrile gloves? If you're out and about and touching surfaces like shopping or getting gas or even traveling, to me, when I think about that, it's like, okay, well, unless you're taking off the gloves frequently and putting new ones on, you have the same concerns about, can't the virus just touch the glove and you touch your face with the glove and it's the same as not wearing a glove? What's the
Exactly.
difference there?
Exactly. Yes, I wouldn't recommend that.
Hmm.
I would not. I mean, if you're going to travel, what actually my wife likes to do on an airplane is take some sanitizing wipes, and she likes to wipe the the tray table and the hand
Hmm.
rests and the areas that you might come into contact with on the plane. That makes some sense. You're disrupting any droplets, any virus that's there, and significantly reducing your chance of coming into contact with it. That would make sense.
So, yeah, I was just going to ask you about cleaning surfaces, sanitizing surfaces that you're in contact with, like at home, for example. Should people consider a more OCD, perhaps, cleaning routine than they would normally do at home with surfaces that they're frequently coming in contact with?
I would say extra cleanliness is warranted, or just bring up your level of cleanliness to where you really want to see it at baseline. Don't be too OCD about it, especially if nobody's sick at home. But I wouldn't go over the top. I don't think it's necessary. But I would just recommend clean bathrooms and sinks and faucets and taps, perhaps a little bit more than you would normally. But
I, I would also add computer keyboards. I remember I read somewhere, I don't know about the science behind this, that they can be dirtier than a toilet seat in terms of germs that they collect.
absolutely, I occasionally work in hospitals, and that the one thing that drives me nuts is I have to touch, and being an infectious disease doctor, right, I have to touch the communal workstations.
Right.
They're keyboards that all the nursing staff and other doctors have access to, and everybody's been touching the same keyboard. And
Yeah.
I'm sorry, you just can't perfectly clean a keyboard. It's not possible.
Yeah.
Uh,
So it
so
seems like a risk there, but maybe at home using some alcohol-based spray would at least be helpful. Um,
yes,
let's go back to hand washing because we kind of flew over that, and I really want to emphasize the importance of this. Most of what I've read, and I think you agree, suggests that adequate hand washing, and I want to emphasize that, is probably one of the most important steps you can take to prevent, yourself from acquiring this virus. But we also know there was a study, I actually wrote an email about it recently. Let's see if I can find it, that showed that these researchers spent time in 10 airports, 10 of the highest traffic airports around the world. And they said only about 20% of people in those airports had clean hands, meaning they'd washed with soap for at least 15 seconds in the last hour. Only 70% of people washed their hands at all after using the toilet in the airport. And of
right.
those who did wash, only 50% of those, so 35% total of people after using the toilet, washed their hands correctly using both water and soap and washing for at least 15 seconds. And I have to tell you, I'm a little bit of an observer of this phenomenon. Like when I go into public bathrooms, I see people come out of a stall and they head over to the sink and they just turn on the water, put their hands under the water for literally like 2 seconds, shake their hands out and walk out of the bathroom. And I just cringe because
I know.
it's like I know too much. So let's talk a little bit about the best way to wash hands with soap so that this really sinks in, because I think that the researchers in this study estimated using some modeling that if we increase the number of people who have clean hands at the airport from 20% to just 60%, not even 100%, to 60%, that could reduce the global spread of disease by 70%, which is just, a huge, huge impact, like more than just about anything we could imagine. So how should people be washing their hands?
Yeah, that's a great question because most people don't do it properly. So, and this is from the CDC, okay, and this is
Mm-hmm.
what we recommend people do. So, wet your hands with clean running water, warm or cold, and then you can turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and under your nails. scrub your hands for at least 20 seconds. If you need a timer, on the CDC's recommendations, they say you can hum the happy birthday song from beginning to end twice. Okay,
yeah.
That's way longer than most people think about washing their hands. Then rinse your hands under clean running water, and then dry your hands using a clean towel or air dry them. And here's the towel thing is what drives me nuts. In lots of developing countries, they have a towel at a public hand washing station. I would never use a towel that other people have used in a public area. At home, it might be different, but you might want to make sure that you're washing your towels, or you have lots of small washcloths and you just launder them routinely, instead of using that same towel over and over again.
So a couple of follow-ups on this. I've read that a clean paper towel might be better than like the hand air dryers because they might be more effective at removing spores. And this wouldn't apply to viruses per se, but other potential infectious agents like Clostridium or something like that. Have you seen any evidence that supports that, or what?
There are quite a few studies showing that it's the friction that's most important. Whether you're using alcohol jelly or washing your hands, it's friction that's very important. And the reason that spores are not very well, like for example, Clostridium difficile spores are not well removed by alcohol jelly because people don't use enough friction. They don't do the rubbing or scrubbing for 20 seconds with alcohol jelly. So,
and I've heard that, I also read a study suggesting that alcohol hand sanitizer wipes were preferable to the jelly for that reason, because it adds more of that friction element. Although that seems to be somewhat controversial. I've read mixed reports on that.
I mean, it makes sense that friction, the additional step of a paper towel on your hand, would improve and would give you more friction and reduce any remaining infectious agents on your hands. It makes sense. In an epidemic, we are more likely to use disposable items. I'm also always considerate of the environmental impact too, as you are. So we need to keep that in mind, where usually in a public situation, the air dryers are sufficient. It's really, if you give yourself that 20 seconds of friction while you're washing your hands, that's probably enough. You also don't want overfilled garbage cans with dirty paper towels all over the place. That's a risk by itself.
Okay, so here's another pet peeve of mine, or thing that I often notice in bathrooms. So you wash your hands, you do it correctly for 20 seconds after you lather. You're already way ahead of the game here, right? But then you go and you exit the bathroom and you grab the handle of the door with your bare hand.
I know.
What's wrong with this picture? So now you've completely negated the benefit of washing your hands. And so, some bathrooms seem to be better set up. They have a paper towel dispenser near the door or close to where you wash your hands, and then they purposely put the trash can near the door, knowing that you should be using a clean paper towel to open the door when you exit the bathroom, and then deposit that in the trash can right next to the door. So I just wanted to point that out, because I don't want people to go through all of this trouble of washing their hands properly and then hold the door with their hand as they're leaving, their bare hand.
That is a pet peeve of mine as well. And well said.
So definitely, people, make sure that you're doing this. I think a clean paper towel is preferable to using your own clothing, because if your own clothing has been, if you come into contact with someone, or someone has sneezed or coughed on your clothing, it's better to use a paper towel than your own clothing to open the door. But I would prefer to use my own clothing than my bare hand, which I'll sometimes do if I've been in a bathroom, for example, where there's no paper towels, because that can happen. So along the same lines, what we've been talking about, hand washing, using the proper technique there, and how exiting bathrooms properly. What if you don't have access to soap and water? We mentioned hand sanitizer earlier, so let's talk a little bit about that. And I have to say, at least as the time of this recording, there is no hand sanitizer available anywhere, at least from what I have noticed. So that's a little bit of a concern. I know some of my patients and other people have expressed concern about that. They're trying to get hand sanitizer, but they're not able to get it. But let's first talk about how to use it, when to use it, and then we can talk about that.
Okay, so you have to worry about the quantity that you're using. So usually the product will have the quantity you should use, and then you apply the gel to the palm of one hand, and then you rub your hands together, and you should do this for 20 seconds. That's 2 happy birthday songs. And remember the friction that we were talking about. So it's relatively simple to use. That's an option. There are recipes online for making your own alcohol-based hand sanitizer that you can use to. And I realize that there are shortages, and that's a problem. A lot of people are starting to hoard these types of things.
Is there any way of making hand sanitizer at home that you know of that would, fit the bill in terms of minimum alcohol content? And we should probably also mention too that some of the natural organic type of hand sanitizers, which admittedly I tend to gravitate towards those products, are not effective if they don't, at least they haven't been proven to be effective if they don't have alcohol content of at least 60%.
Right. I think you need to have 60 or 80% alcohol. I'm not so sure. There are some recipes online, but you want to make sure that you have enough alcohol in there. You can use rubbing alcohol. Remember to keep that away from children. Rubbing alcohol can be a poison. Isopropyl alcohol is a poison for humans, and if you take it internally, externally it's fine. But you can. There's lots of. I'm looking at one now that says mix aloe vera gel, glycerin, and rubbing alcohol in a small bowl, and you can flavor it with, for example, or scent it with cinnamon,
Essential
for example.
oils. Yeah.
Exactly.
Yeah. I think doing that is probably better than nothing, even if you don't get the percentage exactly right. And I would definitely err on the side of more alcohol, than less, just to make sure you're reaching that concentration. A few more other things for folks to think about, like maybe not shaking hands as much as you normally would, like a fist bump or an elbow bump instead, or using things like your knuckle to touch light switches, or just being kind of again, maybe a little bit more what some people would characterize as OCD
Right.
in a normal environment with this kind of thing. What do you think
Right.
about
I
that?
mean, think about elevators I use my elbow in hospital elevators to press the button.
Right.
Also, it's hard not to shake hands. It's really hard, and I struggle with this. But my preferred method is when you're meeting new people, I like the Asian style. Or Japanese style. You put your hands just below your chin, almost in a prayer position, and you just a slight bow of acknowledgement, showing respect. And so that makes the other person feel fine if they've offered their hand to you, so that you're showing them some respect. Thank you, but I don't want to shake your hand, and they'll realize, oh, good idea. I shouldn't do it either.
Or you can make it fun, just a coronavirus fist bump.
Right.
Just like, so it's not personal,
Exactly.
it's not something, and people will get it, and they'll probably appreciate it too. They might be feeling the same hesitation or nervousness about shaking hands. So let's shift over to talk a little bit about prevention, and I'll sort of take the reins here, Ramzi, but I would love it if you chime in anytime.
Okay.
And I want to start with just the basics, because I think we tend to forget the basics in situations like this and really freak out and, or hoard the hand sanitizer and the gloves and all that stuff, and forget to just do the basic things. And actually, one of those basics is stress management. We know that stress weakens the immune system as much or more than just about anything. And there's a little bit of a catch-22 here, or a self-fulfilling prophecy. If people are totally freaked out and panicked about coronavirus, that's actually going to impact their immune system in such a way that it would make them more susceptible to acquiring coronavirus. So
Absolutely.
I've really encouraged people to do some things to try to, if you are feeling really worried and concerned, which is natural, to make it's even more important to do things like meditation practice, mindfulness based stress reduction, spending time in nature, preferably not in large groups, but outside, taking hot baths, whatever it is that helps you to manage your stress. That's even more critical in this situation. So that's one of the 4 pillars of immune boosting. Another one is getting enough sleep. I've done so many podcasts on this. Hopefully, I don't need to go in any detail about why that's important or how to do it here. But 7 to 8 hours a night, and following all the good sleep hygiene practices, it's critical for immune function. Physical activity is also really critical for immune function. So making sure to reduce your time spent sitting and then getting enough exercise throughout the week. And then the 4th pillar, of course, is a nutrient-dense, whole foods, anti-inflammatory diet. But specifically within that context, really I'd focus on foods like liver, which is very high in vitamin A, which has many different immune boosting benefits we'll talk about shortly. Zinc, same thing for zinc, and many other nutrients that are a little harder to obtain, even in the context of a healthy diet. Foods like garlic and ginger, which have antimicrobial, antiviral effects, and also immune boosting benefits. You might want to increase your consumption of those. Citrus fruits and red peppers for vitamin C. Fermented foods, because we know that somewhere between 30 and 60% of the immune system, it really exists in the gut. So that those can be helpful. And then a little bit of extra turmeric, if you like that as a spice, is antiviral, anti-inflammatory, and can be helpful. You might want to consider some extra vitamin A, especially if you feel like you're fighting something, you come down with some symptoms. A improves immune function by several mechanisms. It also increases lactobacilli in the gut, which in the presence of infection will produce interferons and other immune chemicals that fight infection. If you're eating liver, once or twice a week, you're probably getting enough for maintenance. If you're not, you might want to take cod liver oil, which is a great source of A, as well as D, which is another important vitamin for immune function. If you feel like you're catching something, you can take very high doses of vitamin A for a short period. You don't want to do that long term because vitamin A can be toxic at high doses. But 50,000 IU, for example, twice a day for up to 5 to 7 days. You don't want to take more than 100,000 IU at one time because it can cause headaches, and it's a good idea to get enough vitamin D with your A because it greatly protects against the potential toxicity of vitamin A. Zinc lozenges support immune function and have also been proven to be effective in blocking coronavirus and other viruses from multiplying in the throat and nasopharynx. And you can use these several times a day as soon as you begin to feel symptoms. It's best to lie down and let the lozenge dissolve in the back of your throat and in the nasopharynx, so it really penetrates to those areas. So another preventative remedy and something I will use for treatment as well that I like is propolis. Propolis is from the beehive, of course, and it increases cellular immune response and acts as an antiviral. My favorite way to take propolis is the beekeeper's natural propolis spray. It's very convenient. You can spray it in the back of your throat several times a day at the first sign of symptoms. I will also use it prophylactically when I travel, even when I am not experiencing symptoms. And then another product from Beekeeper's Naturals that I love for its immune boosting and protective effects is called Bee Powered. It's a combination of honey, which is antimicrobial and antiviral, and also royal jelly, bee pollen, and propolis, all of which have several immune boosting effects. So I'll often take that if I feel like I'm coming down with something. You can just eat it right off the spoon. Kids love it. It's probably the cold and flu medicine you'll have the least trouble getting your kids to eat and that you might take yourself. And I have a relationship with the Beekeepers Naturals folks, so you can actually get 15% off of the propolis spray and Bee Powered if you go to kresser.co/beekeepers. That's kresser.co/beekeepers. In addition to that, there are some botanicals that really help with to support immune function. Cordyceps is one. It boosts immune function, protects cilia of the lung, modulates cytokine response, and increases T cell count. Cordyceps actually technically not a botanical; it's a parasitic fungus that lives on insect larvae. So now you'll probably never take it after hearing that. It's pretty vivid description, but it's remarkably effective, medicinal. Angelica sinensis, which is known as Dong Quai in the Chinese medicine, aka female ginseng, which modulates the cytokine response and lowers TGF beta levels, which can be high in a viral infection. Rhodiola, which improves immune function and protects the lung cells from hypoxia, which is one of the major impacts that a viral coronavirus can have. Astragalus, which boosts immune function and lowers TGF beta levels. These recommendations all come from Stephen Herod Buhner, who's one of, I think, the foremost herbalists in the world. And his recommendation is to create a formula with 3 parts cordyceps to 2 parts angelica, 1 part rhodiola, and 1 part astragalus, and then take 1 teaspoon of that 3 times a day for protection, and 1 teaspoon 6 times a day if you're feeling symptomatic. If you do feel like you have come down with something, whether it's coronavirus or just a seasonal flu, I've posted some articles a while back. We'll put the links in the show notes to some other recommendations. One is a fresh ginger tea. Ginger is a potent antiviral that prevents adhesion of viruses to the upper respiratory mucosa, but you have to take a lot of it for it to be effective. So in these articles, I have a recipe for making a very potent fresh ginger juice or tea. You use 1 to 2 pounds of ginger, which is a lot. The easiest way to do it is to use a juicer. So you juice it. If you don't have a juicer, you can grate it, but it'll take a while. And then you put 2 to 4 ounces of that ginger juice in a mug with the juice of 1/2 lemon, a large tablespoon of honey, which is also antiviral, and then 1/8 of a teaspoon of cayenne pepper and 6 ounces of hot water. And then you drink 2 to 6 cups of that a day, sipping slowly throughout the day. It does not taste good. I'm going to tell you right now, it's pretty intense, but it can be remarkably effective. And then for antivirals, herbs, if you already have become infected, there's a formula in Chinese medicine called Shuanghuan Lian, which was found to help a lot in China with the previous SARS outbreak, and it's now being tested in clinical trials there for COVID-19. And it consists of Forsythia suspensa, which is Lian Chao in Chinese medicine, weeping forsythia plant. So you'd use 2 parts of that. It's antiviral for the SARS group, including COVID-19. It blocks viral attachment, modulates cytokine response. Then Lonicera japonica, which is Jinyan Hua in Chinese medicine, Japanese honeysuckle. Use 1 part of that. It's also a strong antiviral for COVID-19. And then Scutellaria bicalensis, which is Huangqin or Chinese skullcap. You use 1 part of that, and that's antiviral for COVID-19. It blocks viral attachment, it modulates cytokine response, and it protects the spleen and the lymph nodes. And the dosage for that is 1 teaspoon 3 times a day. And it's best to take that in combination with some of the immune boosting herbs that I mentioned previously. So I know that was a lot. If you're struggling to write all this down, we have a transcript of the podcast. So you can go to chriskresser.com and click on that, and you'll see the transcript, and we'll actually write out the recipes so that so you don't have to dig through the transcript, so that you can just scroll down and get those recipes. And Ramzi, anything else you want to add in terms of treatment? I think in terms of antiviral drugs, we don't have anything that we really know about, know that will work for coronavirus at this point. And what about vaccine for coronavirus?
Companies are already on the way. I mean, just real quickly, remdesivir is a drug produced by Gilead. They're already starting a phase 3 clinical trial. They're targeting 1,000 patients to be enrolled. There's smaller trials taking place in China and the US as well. And the first patient in Seattle actually received that medication. There are Regeneron they're the company that made the antibodies or some of the antibody treatments for Ebola, and they are already hard at work making them for COVID-19. And then there's lots of companies working on vaccines. Vaccines are going to take a while, but hopefully we'll have some treatments. And one of the ideas is that we want to contain the infection as much as possible so that once it becomes even more widespread, we'll have some treatment. So the reason to be super aggressive, one of the many reasons to be super aggressive in containment is waiting for treatments to become available for those that need it.
Mm-hmm. So for those who want to learn more about the science behind some of the botanical recommendations that I shared from Stephen Herod Buhner, you can go to his website. It's a wealth of information. It's Stephen Herod Buhner, StephenHerrodBuhner.com. Click on articles and then click on under the medicine, herbs, and healing section. There's a link. Click on coronavirus. It was written on March 1st. It's a 19-page monograph, which goes into great detail on the characteristics of coronavirus, what's needed, what kind of pathological effects it causes, and then what specific medicinals, botanicals address those particular effects of coronavirus. And so give you a little bit more of the understanding behind how some of these formulas are created, and also additional recommendations for medicinals that I didn't cover in this podcast just due to time constraints. So that hopefully will be a good resource for you. Okay, everybody. Thanks for listening. Stay safe and healthy. Ramzi, thank you so much for sharing your wisdom and experience with us. And
you're welcome.
Where can people learn more about your work? And if they're interested in seeing you as a patient, how do they do that?
For our patients, go to ccfmed.com, and they can learn more about becoming a patient of mine through California Center for Functional Medicine. And I also do some infection control and work for especially nursing facilities. That's capsidconsulting.com.
And although we spent today talking about an infectious disease, coronavirus, and Ramzi has deep experience in treating infectious diseases, that's not all that he does. He's also a phenomenal functional medicine practitioner, and that is what he is primarily doing, of course, at CCFM, although, of course, treating infections is one of the things that we do as functional medicine practitioners. So Ramzi, thank you again, and we'll definitely have you back to do the part 2 of the gluten and Lyme disease connection show, because I know we got a lot of feedback that was particularly interesting to people, and we still got some material to cover there.
Thanks, Chris. Appreciate it.
All right. Okay, everybody. Thanks again for listening. Send in your questions, podcast, chriskresser.com/podcast question, and we'll talk to you soon. That's the end of this episode of Revolution Health Radio. If you appreciate the show and want to help me create a healthier and happier world, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to ask a question for me to answer on a future episode, you can do that at chriskresser.com/podcast question. You can also leave a suggestion for someone you'd like me to interview there. If you're on social media, you can follow me at twitter.com/chriskresser or facebook.com/chriskresser L.A.C. I post a lot of articles and research that I do throughout the week there that never makes it to the blog or podcast, so it's a great way to stay abreast of the latest developments. Thanks so much for listening. Talk to you next time.